Chef Lynn.
Come see us at Mercantile at the Ridge for unique fashions for men, women, and children. The same familiar location, new management, and a refreshing shopping experience with over 125 individual shops. Find what you're looking for at Mercantile at the Ridge, Ringgold Road, Exit 1, East Ridge.
Okay, we're going to talk with Dr. Courtney Guthrie, who is an audiologist with Bridges Audiology, and probably you're thinking, oh, we'll be talking about hearing loss. Not really so much this time, because she's wanting to focus on something that they're now focusing on at the practice, which is dizziness and balance, which I guess when you think about it, that does go hand in hand.
Yeah, so our balance is really controlled by our eyes, our ears, and our lower extremities or our feet. And so we are now doing evaluations to look at all of those parts of our system that help maintain our center of gravity and help us have proper balance function.
Okay, so I don't have hearing issues. I don't think I do.
Yeah.
But I'm sure we've all experienced times where all of a sudden, like you come up out of the water in the pool and there's water in your ear, or just for a second it's kind of clogged and you feel foggy.
Yeah.
So is that kind of the dizziness?
There are lots of causes of dizziness. The most typical causes of dizziness that we see are, and it can be really at any age, from 12 to 50, the most typical causes of dizziness can often be migraine related or due to hormonal changes.
Really?
From puberty to menopause, yes. And oftentimes they can also have what we call benign paroxysmal positional vertigo, which is a very hard word to say.
Yeah, it is.
It's shortened for BPPV, and it is where these little crystals in your inner ear get out of place. And so we can actually treat you in 2 visits and do some repositioning maneuvers to get those crystals back in the right place.
Okay, so often people will stand up quickly and they'll feel dizzy.
Yes.
And you can tend to think that's a blood pressure issue.
It totally could be. So there are lots of other issues other than things that we could look at, like your ears and your eyes and your feet, that can cause dizziness. So our goal is to hopefully shorten the patient's journey that are experiencing dizziness problems, because it's often, they often see 4 doctors before they get an accurate diagnosis for dizziness or imbalance problems, because there are thousands of things that could cause dizziness.
So if they come to you for this, is the way you're testing it able to kind of be a one-stop shop to then send them to the right person to treat it?
Yes. So we can look at the ears and the eyes and the feet. So we are always making this a team approach with the patient's primary care physician. We will always refer back to them so that we can get the proper medical management and treatment plan that they need. But that may involve, you know, an appointment with a neurologist. It may involve an appointment with an ear, nose, and throat. It could oftentimes just involve physical therapy, but there are certain types of therapy for certain types of dizziness or imbalance problems, and we just want to make sure that the patient's getting the appropriate treatment, because sometimes they can have treatment that can actually make their symptoms worse instead of better.
Listen, if you have ever been on the ping pong table of trying to get the right medical answer, and it's not anybody's fault, it's just that you've got a little bit of time in the office, and it's hard.
And it could be a million things. So we can rule out, you know, the feet, the eyes, and the ears. And then if it's not any of those things, we would, you know, of course, refer you back to your primary care physician for any kind of medical testing, maybe blood pressure, blood sugar, things like that.
Okay, if it's the feet, if that's what you find, what does that indicate?
So that can often maybe be caused by like neuropathy with diabetes and things like that. So again, that's treated with a certain type of physical therapy, and basically teaching them ways to do certain exercises to strengthen their balance. So that they decrease their risk of falling.
Okay, if somebody were to come to you, first of all, do they have to be an established patient?
No, they do not. We're accepting new patients all the time. It often does require a referral from your primary care physician, but it is covered by insurance. It is a diagnostic testing that is covered by insurance.
Okay, so they come to you. Will they just simply do the testing that day, or will you also give them like a full hearing exam while they're there?
So that day we're really just focused on the balance and dizziness testing. Of course, if they have hearing issues, we can schedule that appointment later. This appointment takes about an hour and a half, and we want to keep the patients as comfortable as possible. I mean, because if they are having true dizziness and vertigo, some of these tests can actually cause that because we're trying to see what is causing that. So we want them to be very comfortable during the testing.
Right.
So we don't generally do anything else on that day.
So, I mean, I know that we all have these periodic little moments. That doesn't necessarily mean that they're a candidate for this. Do you need to kind of have this be a frequent problem, probably?
No, not really,
No?
but you know, a lot of times it's positional, which means if you lay down in bed on your back or on your left or your right, that can cause you to be dizzy. And if you don't treat it appropriately, it can be a reoccurring problem.
Okay. On the hormonal side of it, that impacts men and women?
Yes, it does. So in the age group of 12 to 50, 1 in 4 females experience dizziness and 1 in 6 males experience dizziness.
Wow.
Yeah.
Okay, so to do this, should they call your office?
Yes.
And then I guess your people will take their insurance information?
Yes, we will make sure we're in network with their insurance plan, which we are for most.
Okay.
And we will make sure that their insurance covers it, you know, and all of that.
If you're not in that 12 to 50 age bracket, could this still be something?
Oh yeah, actually dizziness is the #1 complaint in patients over the age of 65. It is the 3rd most common complaint in people of all ages behind back pain and headache.
Okay, so here is her phone number. Grab your pen and paper. It is 521-3277. Online it's forbridgesaudiology.com, but in this case, call their number.
Yeah, you can request an appointment on our website as well, but you can call.
Why not call and get her sweet people? She's over there in St. Elmo on Tennessee Avenue. It's 4 Bridges Audiology. Thank you, Courtney.
Thank you, Julie. Thanks for having me.
That's so cool.
Yeah.
When it comes to your health, local matters. Count on Local 3 News for expert local advice to help you stay well, live better,